second timer though, that they will not go into bleeding and they will not go into shock.
So it all depends on the physical reaction of the
But
person.
actually, just recently, they're trying to look into the genetic makeup of the patient and the genetic makeup of the virus also. They're trying to look into the genes now. How come this type of serotype will really cause the patient to go into shock?
Yeah.
And this certain type will not. And how come this child, even with this type, will not go into shock, while this other child will go into shock? So the immune system of the also of the patient matters a lot.
Yeah, yeah. Or the physical constitution
Yes,
overall, no?
but one sad thing though with this is that they found out if your child is more healthy, it's not good if they will go down, if they will have dengue fever, because their immune system is so active, and if your immune system is active, you might have a bad dengue.
Oh, that's
So
interesting to know.
for those children living in the squatter area, in the
Yes,
slum area,
they're more.
if they come up with dengue,
They better
they
manage.
better,
They better manage it
that's
than
what we really
somebody who is
discover. Yeah, that's
with
what we really
with a
notice.
pretty strong immune system.
Yes.
I
So
see.
it's the opposite this time, not like
Yeah,
the bacterial infection. If your
yeah,
immune system is good, it's better. If
yeah,
you the way you respond to the bacterial infection is good. But for this type of viral infection, it's the opposite.
I see. And so in this case, when they go into the hospital and they manifest bleeding second day, then you put them in ICU or
Yes. Most of the time, we would like really to put them in the ICU because there's one-on-one with the nurse who will
so it's really touch and
monitor.
go.
Yes, and then the fluids, we really need to monitor it closely every hour. And then if there's a need for the patient to be intubated, if there's a need for the patient to have, sometimes they have pleural effusion. What is pleural effusion? You have fluid in the lung.
Oh yeah, yeah, that's
So we
right.
need to get some fluids
Yeah,
from
to check it
the
out.
lung.
Otherwise, they won't be able
Yes,
to breathe.
yes. So
Yeah.
all these things can be done properly in the ICU setting. So
Because you put the tube here under the
yes,
rib cage.
to
Yeah.
help the child be
Yeah.
able to breathe properly. So really, there are so many complications to look at with these patients on having dengue fever.
And if fortunately the patient is out of danger, or you know that he or she is on the recovery, how long is the recovery period?
Okay, it's like this. Usually, the classical type of dengue is 4 to 5 days fever. Then, when you start to have the fever has resolved already, your critical period is the 2 days from the start of the resolution of fever. So during the 2 days, we need to really look at the patient closely, monitor the CBC every 4 to every 6 hours. Then once the patient has really able to survive the 2 day period, then usually they recover. So that's the recovery period on the 7th day. So from the onset of fever to the 7th day.
To the 7th
So
day.
once you reach the 7th day, then
It's okay.
90 to 99% of this patient, they're okay. They're able to recover.
But within that period, touch and go.
Yeah, but it's really this 2 day period that wherein the fever started to resolve. However, there are some cases like what I've said, the second or third time they're having dengue, the critical period will even start even if they are still having fever. So this is not following what's in the book, what we have learned before. So even in the 3rd day, they're still having fever. They're starting to show some signs of shock already because it's their second or third episode.
What we've been talking about shock. What is the manifestation of a
Okay.
patient in shock?
Shock meaning your circulation has collapsed. So the first manifestation is you will have narrowing of your pulse pressure, meaning when you have narrow pulse pressure, your systolic and your diastolic is so close to each other already. Like for example, 80/70. So that's so close. It's just 10 millimeters mercury. So that's what we call narrowing of pulse pressure. So that's one of the first manifestation of your shock. And then the child will have cold, clammy extremities. Really, the legs are so cold. And then their
Color?
consciousness, they are obtunded. They're like drowsy. You could not really talk to
Talk
them
to them.
anymore. And then their color will start to be very pale or dusky or cyanotic. So those are the signs of shock.
Okay.
And once they go into shock, so difficult for them to pull out.
So that's the thing to really try
Prevent.
to, yeah, try to
Yes,
get
to
away
avoid.
from. Okay, ladies and gentlemen, we'll be knowing more of dengue and maybe a little bit more of leukemia when we get back here with the doctor.